My name's Helen McFarlane. I have been working at Bloomfield now for nearly 21 years. Now I work in the role of innovation and performance. Traditionally, to be able to access mental health services, you could go through your GP or you could present up to the ED. The way that the world has now opened up to people is that access is available through non-government organisations, through community managed organisations, as well as community mental health teams, which are huge now compared to what they used to be.
If someone presents in crisis to hospital, there are a number of different means that we can support them. We provide a safe space, we provide reassurance, we normalise their experience. Then there are the sort of next steps that we can do, including offering medications and psychological support, and then bringing together their external support like their family and friends as well.
I think accessing support from any mental health and drug and alcohol service has become much easier over the last 5 years with a no wrong door policy. I can't think of many services that haven't adopted that on some level, government certainly and non-government, which means a consumer's ability to navigate the services and find out what they need is then put in the hands of the clinicians and the professionals.
You can present yourself, or you can present with somebody that is your carer, or you can present through education systems, TAFE systems. There's multiple ways of being able to present to receive the help that you need.
My name's Chris Bassingthwaite. I live in Dubbo. I'm a structural engineer and I'm married with 2 young children. So around 5 years ago, I was required to support my wife who had a lived experience, which was postnatal psychosis after the birth of our first child. It was quite daunting, it was scary, and it was sort of unknown. I didn't know what I was getting into or where we were going. The admission process into the MHDA service was fairly straightforward. It was a clear-cut reasoning for us having to go there, and it was quite an easy process. Basically, we went from one ward of the hospital to another ward of the hospital, and it was seamless, essentially.
So my name's Abigail Palmer. I'm the mental health peer worker in Orange Emergency Department. And when I'm not here, I run my own business as an equine sports massage therapist. The admission side of things, it was kind of, I just got pushed off a little bit. I didn't get a say, and yeah, everyone was talking about me around me, and I just felt like I was a bit left out a bit when, hey, I'm the reason we're all here.
My name is Jacqueline Rudge and I am a 5th generation Bathurstian. I serve on Bathurst Regional Council. Admission was quite good. I wasn't stressed in any way. The staff made me feel comfortable and welcome.
So my name is Glenda Payton and I like to play the piano, read and do photo scrapbooking and diamond art. I remember I had my bag ready to go. I knew I needed help and they did understand that, so I was admitted to adult acute for a few days and then on to Amaru.
Oh, I was absolutely terrified. I was absolutely terrified considering like when I was 11 I had my first experience and it wasn't the best, and that's what really originally made me stop talking, is because every time I opened my mouth I was put into hospital. And yeah, I was absolutely terrified. I was just, here we go again, I can't do this, and I was an absolute mess. So I remember screaming to Mum and Dad, don't leave me here, and just seeing everything locked up, I was terrified and I was really, really scared, yeah.
I'm Candy Lee Trudgett, I'm 44 years of age. I've been through domestic violence and I've had drug use in my life for the last 20 years, and I've made a change recently over the last 27 weeks and I'm drug free. And I'm a single mother of 5 children. I didn't know what I was going to. I just come from legal matters at court and I didn't know what I would put my hand up for. But when I got the friendly staff at the counter, got me feel comfortable, didn't feel like I was going to do something with paperwork, more paperwork, more paperwork, more paperwork, more signing. It was more that I felt like someone's there to listen to me.
My name is Anne McLaughlin. I'm from Dubbo. I'm a consumer. I'm actually trained as a librarian, and I love painting and drawing, and I would like to be a peer worker. When I was admitted, as I said, that was, to be honest, was scary. I felt like I was alone. As I went through, I sort of got into the routine of what everyone was doing.
What our ethos is that we hope that you get the support in the community prior to needing to come to hospital. So if that's what you need, then you will see a community mental health clinician. You may even see a peer worker these days, which is something really exciting that we have implemented across our district. And a peer worker is somebody that has had a lived experience and has gone through the pathway, and they're there just to guide and support and provide a safety, I guess, to ensure that people feel comfortable in entering the service wherever they enter.
When you do come in to get some help from mental health and drug and alcohol services, you'll see and be exposed to a number of different people, including nurses, social workers, psychologists, doctors, and then we also integrate get support from family and carers as well.
So services available while people are in the inpatient setting are a multitude. So we actually encourage all stakeholders to inreach into our services. So anyone that you've been engaged with in the community is welcome to come in and be a part of your care plan or support plan that we develop, and your transition out of hospital plan. Family and carers are an absolute necessity. Your GP can be a part of that. So pretty much anybody that you want to be a part of your plan and your transition out can be included.
At anywhere in the process of treatment, options for broader community involvement is offered and invited. So on a patient's visit to the Orange Health Service, inpatient from drug and alcohol, we have clinical nurse consultants or consultation liaison officers that will see them in the emergency department or in the mental health wards. They will look at responding to the client's needs as quickly as possible. That's a high pressure point of contact. Often they'll refer to where I work in the community for ongoing counselling, and depending on what the client needs, we have qualified counsellors, social workers and psychologists.
Everyone was there to help and to care and to get the person back to their normal self, the person that was having a lived experience. That was their primary goal and their job, and that's what they did. They were being looked after in their ward. I was able to visit them whenever I needed to, and I was informed about their situation and condition regularly, almost daily, by the staff.
The most recent admission around about 5 years ago, I was in adult acute for about 5 days. I think I would have probably transferred to a less acute ward a bit earlier, but we were just waiting for a bed to become available. So I moved from adult acute to Amaroo, which is a bit more people who are a little bit more well. What I did find challenging was when I went from Amaroo in Orange to Bathurst Panorama Clinic, I had been able to just have leave during the day and come back just for meal times at Amaroo. I could walk around and do my own thing but be back for meals. When I was transferred to Bathurst, at that time I was only able to go out for about 10 minutes of every hour, so while it was a lovely calm environment as well in Bathurst, I did find it challenging not being able to walk outside for fresh air.
I felt I didn't have to face the outside world for a little while, and I had time to concentrate on me.
Doctors and nurses were available to help me during the period. I sort of decided that I didn't really need much help myself. It was more the person that I was caring for. In the end, it all turned out really well. It took time to get there, but patience and listening and following instructions that were provided from doctors and psychologists and what have you was key to that recovery.
Obviously the first few days were quite daunting, especially being so young and not really knowing what's going on. But as soon as I realised that I wasn't alone, and that the staff in there are just absolutely gorgeous souls who just absolutely put everything on hold for you. I really started to relax and felt safe. I really felt like that, hey, I think I can be here. Look at all these kids, and some of them are worse off than me, but yet I still felt like my life was so awful, but I realised it wasn't. And I actually made some really good friendships and connections that first time in CAMS, and to this day I've even still got a really good friend from CAMS. I definitely never felt alone again, and for me that's one of the biggest things that has really, really opened my eyes, was just realising how many people are out there with mental illnesses, and you just kind of got to step back and be like, you know what, I've never been alone. That whole time I was never alone.
My name's Bex, and I am a mother of 5 actually, and a student of social work. And I've lived in Bathurst for a couple of years now. I found the nurses and staff really approachable. They were lovely, they were supportive, and any questions that I had about the process or anything, they were available and there, ready for a conversation.
So medicine is an important part of what we do. However, there are a number of other things that we can do to help our patients. Obviously, psychotherapy is one of the big arms of our intervention, but we also work with our clients to optimise their psychosocial environment at home. So and that might involve talking to carers and friends, liaising with government bodies or whatnot to make sure that we can remove some of those psychosocial precipitants of the reasons why they came into hospital.
The discharge plan for consumers and carers is offered on the day that they leave the unit. We now prefer to call it a transition plan because you never ever just get discharged. We're always, or somebody is always part of your support network. And it goes with you, and it goes to your GP, and it goes to any other key stakeholders that you've asked for it to be sent to.
At the time of discharge, I was asked whether or not I had support at home, and whether the person that I was caring for would have other support mechanisms in place. And the doctors and nurses did ask us that at the time of discharge, and thankfully we did have a high level of support through close family.
I was just so excited, I was just so bubbly, and I was set and I was ready to go. I do remember like the week leading up to it, we had quite a lot of meetings, mum and dad, with all my doctors, with everybody involved, just really preparing me, but also not only that, but setting a plan for if I got home and things fell apart, what was going to happen. And I was really, really involved in that plan because a lot of it came to me.
So discharge plans are very important to get right. Basically it involves looking at what home is going to be like for the person. It's looking at what supports they're going to have when they go home, and that's going to include not only their family and friends, but also supports from community mental health or our services, but also their GP, non-government organisations, psychological service providers, and then I guess the other aspect is looking at crisis plans, or what happens when things don't go exactly the way we want them to.
Well, the peer support workers actually came to the transition unit. They matched you up with a person, and they used to come quite regularly, and that was with the local health district. I had that person, plus I had the people from Flourish. They came as a group, which is really good.
She was supported as she was leaving. She was handed over to me and we had quite a bit of support afterwards, checking in to make sure that she was doing okay, and we knew that we could call if there was ever any issues going forward. So, and we did actually have to do that for a second time.
Once a person's discharged from the mental health unit and discharged into the community, they can expect that there are a lot of support mechanisms in the community. We were quite lucky, and we had various nurses and social workers call by our house frequently, so that was worthwhile. It's good.
I really think that people should, as much as possible, be discharged into an environment that is suitable for them to be able to work through the different challenges that they are facing. Accommodation where they have support from either community organisations or their own family and carers is really important. And just to have that follow-up care from their community mental health team, and being able to be linked into all the supports in the community following admission, I think is really important.
Consumers at the end of their stay in hospital will be able to expect that all their key stakeholders have been engaged with their transition plan. And within 24 hours to 48 hours of them leaving hospital, they'll have contact by a community mental health team member to ensure that they're going okay.
The discharge is probably the most tender or vulnerable part of the counselling process. Any stakeholders that are involved with the client care, other government agencies, oftentimes housing is involved with discharge planning. But making sure that everyone's kept informed and again, that the consumer is invested in all of it.
I had a caseworker and I used to see her quite regularly at the local health district. And also had a psychiatrist, I should say. I also had a stay in a place called with Flourish in Orange, which was really good. It's more one-to-one in a home rather than I may have had to do another transition stay, but they specially set that up so that you didn't have to necessarily be in the hospital, and there was peer workers there and you could talk. Like I often had when I was there, usually 2 or 3 days, they picked you up from here and took you down, which was really good, and just had someone that understood where you were coming from.
So supporting the consumers in the community means regular follow-up and tailoring that to what the consumer feels they need.
Caring for someone with a mental health illness can be challenging at times, and our carers can expect to be supported through the case manager of their loved one, as well as being offered support from their GP and other services such as counselling and debriefing.
I think that carers and consumers would expect that they're going to be very well supported by the team that is here around them, and that it's just also a matter of reaching out whenever it's required.
So a carer at discharge will expect the same as what the consumer has. They're a part of the care planning, they're a part of the transition plan out, and they are aware of all the supports that are in place for follow-up appointments.
Recovery is a concept that means that some aspects of mental health may stick with us for an extended period of time. It means that basically we're looking for the best available adaptation to life, which means returning to what the patient wants to get out of their life: extracurricular activities, employment, maintaining healthy relationships with others, enjoying a healthy sense of spirituality, and engaging in their culture and other things that might be important to that person.
Recovery as something deeper than just abstinence: freedom, empowerment, connection with one's own sense of identity, as well as the identity of their loved ones or the community.
I've heard people say, yeah, I'm clean for 2 days. 1 day is better than none. I thought that recovery was just, to get clean. I didn't understand that recovery was about, I've got to change my way of living, change my lifestyle.
Having purpose in life, having something to get you out of bed each day, that someone relying on you to be healthy. Like I said before, being busy but not too busy, not too overcommitted, but having a few things in life that make you happy and help other people. There's lots of call lines, 1800 011 511, or other helplines like Beyond Blue, Lifeline. You can search up and talk to someone.
Recovery means to me is getting on with my life, doing what I want to do, doing the things that I enjoy, spending time with my family and friends.
In a way, I haven't really recovered. I've just learned how to deal with my mental illnesses, and because I know that it's just something I'm going to have for the rest of my life, and so it's all about learning how to deal with it and learning how to deal with it on a daily basis.
Does anyone ever get better from a mental illness? Well, that depends on the person that you ask at the end of the day. What we're here to help hopefully promote is that we're supportive, We provide a safe and caring environment so that if they do become unwell again, they know where they go and they know who can help them.
Ask for help at every opportunity, to learn the signs from your loved one and act early. Recovery is sometimes lifelong, I believe. There are good days and there are bad days, and we just support and love her and perhaps provide advice at times, but not always. That's not always helpful. And just let her know that we're here and love her and care about her and how she's doing. So ask questions regularly to see, engage how she's going. All of those kind of things is what I do personally. Seeing my daughter thrive after being supported so well by people around here and being a part of that for her has been fantastic. She's doing so well, she's independent, she's off in a different city and loving life.
In the end, yes, I did get, well, I'm still getting to the end of the tunnel, but the tunnel's a lot not so dark now, if you can say that. Yeah, there is light at the end of the tunnel. It does take a while, and it is something that you work on. It's not the destination, it's the actual journey. You know, like it's, you know, they talk about like another train going through a tunnel. Well, that's me going through the tunnel. And the tunnel's long, but you eventually get there.
If there's one thing that I would like to continue to agitate to change, it's to have more people with lived experience be a part of the journey in the inpatient setting. I think we've started and we're doing really, really wonderful things in that space, and I think the evidence is there to show that peer workers actually do assist people that are feeling very distressed and very vulnerable. So I continue to agitate for more peer workers.
If I could make one improvement to drug and alcohol mental health services, it would be a reduction in waiting lists and prompt access to the services, any service.
Well, it's always good to know a little bit about the time frame, how long you'll be there, but I understand that that's not always possible to find out straight away.
To have a day program. So I could live in the community and do my rehabilitation. I didn't have that opportunity. Being in the country, I know they do in the city, had the opportunity to go to rehab every day and come home to their family. That's the one thing I would like to change.
So I think that when you live local to services, it makes a huge difference. I know that from the place where I previously lived and during the time when I was a consumer, that wasn't readily available. I was very isolated, and so to live in Bathurst and to have those support services right on our doorstep, huge difference.
Put your hand up and ask for help. It's out there for you, but you just really, really need to put your hand up and say, I have got an illness, I am sick, please help.
The GP needs to recognise that you need help. They take the steps to get you into services such as the Panorama Clinic. And I guess that's probably the hardest thing that people have to do, whether it be depression, drug or alcohol. You have to have an understanding that you need to be there, and you have to accept the reasons why you are there.
Living locally was definitely really, really helpful, especially when I was an inpatient, knowing that my family wasn't too far away at all. You're going to be okay. There's this massive support group out there that work day in and day out just to help you, and that you're not alone. And I think that's such a big thing for people to realise, is that you aren't alone, and that there's so many of us that do suffer with something, and we may look okay, we may have this smile on our face, but deep down we're all fighting our silent battle.